Hi, my name is Vanilla Dasgupta and I am author of the book Two Pink Lines. So today I want to talk a little bit about a question that I'm asked all the time. What is the best fertility clinic out there? And which one's the best one for me? Well, it's not easy as X is the best clinic. It's a little bit more involved, so I thought I'd talk about it now. So there are two sites that you're going to make note of. The Society for Assisted Reproductive Technology, a long name, abbreviated to SART, S-A-R-T, and the other one is the Center for Disease Control, the CDC, and you may have heard of the CDC. Now, both of these sites are really good for IVF information. A lot of clinics post their success rates, their IVF success rates, to these sites. SART, there are some problems with SART in the sense that not all clinics are members of SART. They're not members of the society. And those that are don't necessarily always post their success rates to SART. However, their data is up to date. The clinics that do post their results, they are up to date and they're very informative. Now the CDC, they have a very big comprehensive list and a long verification procedure, and they're very accurate, etc., in posting their results, which is really good. However, the problem with the CDC is that because of the long verification procedure, it takes about 3 years to accumulate all the data, and they are about 3 years behind. So in terms of what you're looking for, which is the best clinic for me today, I would go with SART. They're still a really, really good resource. Now, the best place that I have found in terms of collecting all the data from SART and arranging it in sort of age groups is a website called fertilitysuccessrates.com. And I've made some links up, and you'll see them in chapter 15 under the blog that I'm writing in the book. And certainly in the book, all of this information will be there. Now, that's a really good website to look at. You can look at under 35, over 35, 40, etc., and you can see which clinics post their success rates and what those rates actually are. So, you're probably thinking, great, all right, I'll go to that site, I'll click on it, I'll see the first name, which is the best rate that's out there, and I'll choose that. Not so quick. There are going to be a few questions that you're going to want to ask before you just choose the best one with the highest score. You are going to ask a few of these questions, and I've made a note of them, so I'm going to read some of them to you. You're going to ask, does this clinic treat my diagnosis? So when you call them up, you're going to want to know, in your infertility diagnosis, do they deal with diminished ovarian reserve, for example, if that's what you have, or PCOS? Because that's going to make a difference if you choose that clinic or not. For example, with diminished ovarian reserve, that's a tricky diagnosis, and not all clinics want to deal with that. So if that's not a clinic that has experience and success with that, you're not going to want to choose that clinic. With that diagnosis, or with any diagnosis that you have, what is their success rate in terms of that diagnosis? You're going to want to get really specific and pin them down to giving you some more details about their success rates in terms of your diagnosis that way. Second thing that you're probably going to want to ask, will they be willing to work with my health insurance? There are a lot of blood tests, as you know, that you have to have, and all sorts of other little tests. Now, some clinics are really, really happy to work with your health plan. For example, my doctor was really happy to work with Kaiser, and I got a lot of my blood tests done at Kaiser, which really kept the cost down for me. Otherwise, going to a designated lab that the clinic has ordered, you know, those costs can add up. So you're going to want to see if that is possible for you, and obviously that may be a bonus if they are willing to do that. The third thing, the number of embryos transferred. Now, this is a hot topic at the moment. One thing you're going to want to remember, more is not necessarily better. In fact, clinics that say, oh, we'll give you the best possible chance, you know, put 3 embryos in, 4 embryos in, be aware of those clinics. You do not want to go with those kinds of clinics. It is not considered to be the best for you in terms of risks and your health. So 1 or 2 embryos is what you're looking at, which is pretty standard. There's now a fertility clinic procedure called the mini IVF. There's only one clinic that's doing it, the New Hope Fertility Clinic, and again I've got this linked in this chapter under the blog. Now this clinic will transfer 1 embryo, and they have really good success rates. So, you know, check that clinic out and see if there are any other clinics that will work with you in terms of transferring 1 embryo or 2. But you want to know how many embryos they feel that they can successfully transfer and what their policy and ethics are around that. Okay, number 4. How far away is that clinic from me? You know, 2 hours, if that's 2 hours away, yeah, sure, why not? Once. Okay, that'll be good. But as you know, IVF is never going to the doctors once. In fact, it involves multiple visits. And if your clinic is 2 hours away, then you may want to consider, what is that going to be like if you have to go 2 or 3 times a week? What's that like in terms of gas? What's that like in terms of time? What's that like in terms of taking time off from work? These all need to be considered. All right. The next one, number 5. How available is your doctor going to be? I've actually had clients in my practice who have said that they have hardly ever spoken to their doctor. That doesn't seem right to me. So you're going to want to know, what is their policy? Are you going to have availability to the doctor? Is the doctor going to call you back, or is the nurse going to call you back? You may not have any problem with the nurse calling you back, but you're going to want to know beforehand. And do they have an emergency system? Is there a 24-hour answering service? Well, they'll dispatch you right through to the doctor if you need to speak to the doctor in the middle of the night at 2 a.m. All those things really can make or break a deal in terms of choosing a clinic, and so you want to know what you will feel comfortable with. If you want to have access to your doctor, then that will be important in terms of choosing a clinic, right? Okay. Alright, I think overall those are the questions that you need to be asking of clinics, and there's more details on this page in the blog, and there'll be more details in the medical chapter, so feel free to send me your questions, fenella@comcast.net, or go to the blog and post away, and stay tuned for my next podcast, which I think will be on interviews with a leading fertility reproductive endocrinologist. A wonderful title there. Alright, I will speak with you soon. Bye bye.